Well, migraines affect nearly 40 million Americans, more women than men, but many don't even know the difference between a headache and a migraine. And here to help us better understand all of this is Dr. Mehdi Ansarinia. He's a local neurologist who specializes in headaches and migraines only. Doctor, thank you very much for joining us. And talk about this. Migraines can be very debilitating. I don't suffer from them, but I know people who do, and it could take them out of commission.
Absolutely. It's a very debilitating condition, and it affects people in the prime of their life, disrupts their daily activities, and they have to plan their activities around when they're going to have migraine, and it basically afflicts the whole family.
And there's a big difference, obviously, between your typical headache and a migraine.
Absolutely. Migraine is one type of headache, but it's one of the most common type of headaches, and it's very debilitating. The features that identify migraine and set it apart from other headaches are nausea, light and noise sensitivity, which accompany the headache, and headaches get worse with activities.
And what's the remedy here? What can people look forward to down the line here? Is it just pretty much, do they have to continue just treating it as they go? Is there any sort of long-term help that you see?
But there are several aspects of treatment of migraines. One is to identify what triggers or provokes the migraine and try to avoid it. Things such as loud noises, fumes, bright lights, avoiding changes in weather if possible, hormonal changes can all bring on the migraines, but also there are medications that can be taken daily to prevent the migraines, and in addition, medications can be utilized when the migraines arise to treat them. More recently, Botox was approved the past few years, which is also very effective, and the injections every 3 months help in reduce the number of migraines.
I know sometimes it can be very hard for those of us who don't suffer from migraines to really understand how people have to cope because, like I said, some friends of mine who suffer from migraines, when they get one, that's it, lights out. I mean, they go into a room, they got to shut the lights, shut the doors. Is that often a part of the problem that when you talk to patients who suffer from this about how they can relate to the public out there, just how hard it is to deal with these migraines?
Absolutely. There need to be a lot more public awareness of the significance and the degree of debility that it causes. And important for the education of the people that are afflicted with migraine is there is a lot of treatment out there to prevent it, and the treatment needs to be done early so they don't have to suffer. The message needs to be there is treatment and people need to go out and get the appropriate help that they need.
Okay, doctor, thank you very much for your time. Thank you for enlightening us today.
Thank you for having me.
All right, we'll be right back.